Scoliosis progression in teens is largely driven by growth. During rapid periods of skeletal growth, especially adolescent growth spurts, the spine can change quickly because the vertebrae are still developing and are more susceptible to the asymmetrical forces. If a curve is already present, uneven growth on one side of the vertebra can cause it to worsen, a concept often explained by the vicious cycle of scoliosis. The curve that creates uneven loading, and that uneven loading promotes further curvature. And this is why younger patients, especially with more growth remaining, tend to have a higher risk of progression compared to those who are skeletally mature. Another major factor is the size and pattern of the curve itself. Larger curves at the time of diagnosis are more likely to progress than smaller ones. And certainly curve types, such as thoracic curves or double S-shaped curves, can be more unstable. Rotation of the vertebra also plays a role. As the spine rotates, it can increase structural rigidity and make the curve more resistant to natural correction. Muscle imbalances, postural habits, and asymmetrical movement patterns may contribute to how forces are distributed across the spine, although they are usually secondary influences rather than primary causes. Genetics and underlying conditions can also influence progression. Some individuals have a genetic predisposition that makes their spinal structures more likely to deform, especially under stress. In other cases, scoliosis is associated with neuromuscular or connective tissue disorders, where muscle control or ligament integrity is compromised, increasing the likelihood of worsening curvature. While many of these factors are outside of direct clinical control, early detection, monitoring, and appropriate intervention can significantly reduce the risk of progression and improve long-term outcomes. To walk through all your red or green flags with your scoliosis, reach out at ScolioCare Louisville.